Hi friends, today we'll discuss about speaking criteria. So here some of the criteria you need to keep it in mind whenever you are doing the speaking. We'll discuss only the important speaking criterias. The main two important criteria in speaking means one is like communication and second thing is like reassurance. Communication means see we have some task, so based on that some task given for them, that means for the patient they have given some task that is like question type task given for them. Okay, so here so we need to involve the patient also in our speaking. See, when we are speaking, so in between they are asking the question. Okay, so here some interlocutor, they won't speak, they will keep quiet. So what we need to do? So usually whenever we are finishing each task, they will ask the question. So based on that, we can speak continuously. But in rare case, some of the interlocutor, they won't speak. They will keep quiet. So in that situation, what you need to do means simply don't ask like, do you have any other concern? Because instead of asking that question, because that task not given for us. So if they have given task like find out any concern, so if not given, so don't ask simply do you have any other concern. So what we need to do means see based on our task put question for the patient. That means our next task is like explain the procedure of what IV canalization. So we have given little time for the interlocutor to ask question, but we came to know that they are not asking the question. But if we are talking about our task, then it looks like one way communication. So in that situation what we need to do means we need to involve the patient also. How means see we have task like explain about the procedure of IV canalization. So what we need to do means based on our task put question for the patient like do you know anything about the procedure of IV canalization? Then definitely they will open their mouth, either they will tell yes or no. So that way we can maintain the communication. So keep it in mind that each task we need to involve the patient also. That means we are not only speaking, we are not only focusing into our task, we need to involve the patient also. Communication is very important in speaking. So like communication, reassurance also important in OET speaking. So reassurance means patient is coming with their concern, that means they have some problem that we need to clear. So without any doubt they should not go back. So we need to give clear cut about their procedure or about their disease condition. So what we need to do means we need to give some reassurance. That means we need to give some psychological support to the patient. So some of the reassurance you can use. That means patient is coming for one surgery. Patient is very worried about that procedure because he never had before this procedure. So what we can tell, so no need to worried about this, it is a simple procedure, we have an effective strategy to cope up with your procedure. So we are there to take care of you, so no need to worried about it. Then you can use like, I know it's really difficult for you to cope up with your current condition, but please try to follow the instructions. So if you follow the instruction, definitely the future complications will be greatly reduced. So then you can tell like, I can understand your worries. Okay, so each whenever they are asking the task, you can tell like, I can understand your worries, I can understand your concern, or else I can understand your difficulties, or I can understand your problem. Okay, so whenever they are asking question like, well, all right, so this answer we can give to the patient whenever you are speaking with your friends. So practice like this, like instead of telling okay, so we can use like well, all right. So so that if you are using the different words, you will get good score. Okay, so try to use some reassurance points in between the task. Okay, so then next, the wind up session. So based on your task, you would wind up. Simply don't use like here is the press button. If you have any concern, please press this buzzer so I can help you. See, the task is like different way, but you are using different. So don't use like that. Always based on your task, you wind up. For example, you have given a patient have some concern. He came to us to get some suggestion to quit his smoking. So what we have given some instruction how to quit smoking. So we can tell like, so I have given, I hope you will follow the instructions. If you follow the instructions, definitely you can come out from your bad habits. So like this way you can wind up. That means always whenever you're winding up, so based on your task, you wind up. Okay, so at last you can tell like thank you. Okay, so these are some important criteria you should know whenever you are speaking. Then please do not use two words in speaking, that means should and must. These two words looks like judgmental talk. That means should means we are ordering the patient, that means you should do it or you must do it, that means we are ordering the patients. Never do that. Okay, never use should or must in the speaking. Always we need to request the patient, please try to follow the instructions. That means already patient is coming with many concern. Then if we are ordering the patient, then they feel bad. So always try to calm and speak in low mood. Okay, so if the patient is angry or getting angry on us, please do not get angry on the patient or do not raise the volume. So what you need to do means try to make the patient calm. Okay, so then if the patient is in sad mood, we need to show that feelings to the patient. Okay, then what they will feel, they feel like, so patient, this nurse is involving in my problem. So that is the speaking. Okay, so how we are speaking nicely with our friends or neighbors, the same way we need to speak. The main thing is like you need to maintain the communication as well as you need to use some reassurance sentence in speaking. If you are using these two things, definitely you will score B score. Okay, so next we can discuss in next class. Thank you. Bye.